Hello, we're live in a gastric sleeve procedure. So what the doctor right now is doing, he's actually introducing the chokers. So he's starting the procedure, just making sure everything is good inside. He's checking up and actually starting to introducing the ports of the gastric sleeve. So this is what is going on right now. So right now he's actually just making sure that he's inside of the cavity, just making sure that he sees the stomach. He wants to be safe, he wants to be clear, he wants to make sure that the patient is fine. So right now what we're doing right now is we actually starting insufflating the stomach, just checking the inside and the cavity, measuring the stomach, and getting enough information of the patient inside cavity to start the surgery. So she has a long liver, so what I can see, she has a long liver. And that is not a condition, it's just a situation that the patient has. So what you can see right now is how the chokers are being introduced. Just checking out how they look. And all the devices are already activated. So we're here in Hospital INT, which is a really nice hospital in Tijuana that has all the services that it's needed to be able to perform a gastric sleeve. So he's Dr. Alberto, he's a board certified plastic surgeon, he's a bariatric surgeon. He is known as a good bariatric surgeon in Mexico, also has his board certification in the United States as a bariatric surgeon. So what we have right here is inside of the cavity. We're inside of the cavity and we're doing the gastric sleeve. Hi again. So if you're interested on having this kind of procedure, which is a weight loss procedure, you can ask me any questions. I would be happy to answer you. So this procedure is a really nice procedure. It's the one that has the most basically has the most rate of success of all the weight loss procedures that you can actually see, which is the gastric sleeve, and also provides enough after, basically has less uncomfort with the patients after having this procedure, because they're going to be able to eat, they're going to be able to perform their lives just properly and the same way that they did before, just by eating less and having a better and healthier lifestyle. So what you can see right here, it's how they go inside of the cavity and how this robotic surgery is going to be performed. So this surgery is going to be performed done laparoscopically. So it's a robotic surgery, as they used to say. So it's a less invasive one that is going to last only 45 minutes if it goes the right way that we wish. ¿Puedes dejarla prendida? Sí. Un ratito. So do you all OR's rooms use the same anesthesia machine? No, actually we have different kind of anesthesia machines in each room. It's the same kind, but definitely this one right here, it's an specific and different OR that has all the different equipments than the last one that you saw. So what we have right here, he's actually going into the top part of the stomach. So right here where we have the vessel and the liver, and this right here is the stomach. The importance of this procedure, the only thing you have to know about it, about the insides, is that your stomach is going to develop a hormone that is called ghrelin. So ghrelin is gonna make you have the hunger sensation, and you're gonna be eating more every time it's released. So we're gonna take that part of the stomach, and we're gonna have a smaller stomach that is gonna have enough capacity to eat without restrictions and without gaining weight. So we're gonna be eating less than we did before, 6 to 8 ounces at first, and just little by little we're gonna be able to eat more. But this is gonna be like your inside doctor, which is gonna remind you that you have to be eating slowly, and you're gonna have to be eating many times a day, and you're gonna have to be eating many times a day too. Slowly, many times, and in small quantities. So the main importance of this procedure is the weight loss. So usually patients would lose something close to 10 to 80 to 90% of the excess weight. So what we can say they can lose from 50 to 100 to even 150 pounds with this procedure, depending on where we start. So if we start with 300, then we're gonna be losing more. Maybe we lose 100 pounds. If we start from 220, we're just gonna be eating a little bit. If we're gonna be losing a little bit, we're gonna be losing maybe 80 pounds, 60 pounds, but just depending on what we need to lose. So some patients would need to lose 100 pounds, some patients would need to lose 200 pounds. So everybody's gonna be losing differently. So for the patient that has a high BMI, they should start with the gastric sleeve, and maybe a year or 2 years later, they're gonna be able to do the gastric bypass. So a combination of procedure could guarantee you a better weight loss success when you start maybe for 100 pounds. If you can make the stomach smaller as the patient requires, well, basically no. The reason is because if you make a really small stomach and you make a bigger stomach, the weight loss at first might be the same. But the thing is, in long term, patient will actually be able to eat more, and they're gonna be gaining the weight back, and that would be an uncomfortable situation. So what I would recommend is either we do it fully, completely, to 85% of the stomach, or maybe just be a little more conservative. You have to talk to the bariatric surgeon just before going in. And maybe we can please you just by taking maybe 70% instead of the 85%. But just leave that cut 50% only is not worth it. So, okay, so this is how the gastric sleeve is going to be performed. So what he's doing right now, he's actually separating the stomach, just leaving a small stomach. That this small stomach is going to be stapled and separated from the older stomach, and that older stomach is going to be taken out. So you will not have one part of your stomach, but you're going to be able to eat the same things that you eat. You're going to be able to absorb just by less quantity. So what you see right here is the incisions. So the incisions is only 4 incisions, so it's a small laparoscopic procedure. As you see with their place, it's easy to remove when you do the tummy tuck if you're ever gonna need it. So usually these kind of procedures mainly are not performed for cosmetic results. They mainly perform for weight loss matters, but also you're gonna be looking better, but you're also gonna be feeling better, and you're also gonna be healing better, and this procedure is definitely worth it. So as you see right here, we have the harmonic their scalpel. So this one right here, it's moving to a speed, really high speed, and it's cutting just by friction. So it heats up the first part of the scalpel, and it's you're just gonna heat it, and it's gonna take the vessels away. So you're going to not bleed inside of the stomach. Even after this procedure, we're still going to leave for security a small drain to know exactly what's going on in the cavity, and to make sure that there's no leakage or bleeding after the procedure. So you're gonna be having to stay here in our hospital for a couple of nights. So you're gonna be staying for a couple of nights, and so it's gonna be 3 days with this procedure, and you're gonna be able to go back to work, and you're gonna be able to go back to activities right as soon as you get home. So usually most of the patients will take 7 to 15 days just to recover and to get used to the way they eat and the way they're gonna be eating. So this is composed by 3 surgeons, right? By an OR nurse, by the anesthesiologist and his assistant. So we have all the combination of the teams for having a safe bariatric surgery. So that's how the stomach it's being separated. So we're probably close to the 50% of the surgery. So we're gonna log out and we're gonna go to Instagram. So please follow us on Instagram. So our Instagram page is Vive Plastic Surgery. So Vive Plastic Surgery, you can log in and check out the next post so you can see what's going to end up with this patient having gastric sleeve. Thank you so much for watching. Subscribe to our channel. This would help us a lot to grow our channel in YouTube. So please let us know if you have any specific surgery that we would like you to be transmitted. So for our viewers, if you have any questions, if you have any further information that you need, you can send us an email to viveplasticsurgery@gmail.com.